Joining us now to talk about the problem inside prisons with COVID-19 and the response is the director of the National Prison Project for ACLU, David Fathi. And thank you for joining us, David. What is the problem you guys are seeing right now?
The problem is that prisons are essentially the perfect environment for rapid spread and maximum damage done by the COVID-19 virus. And so prisoners are really just sitting ducks who are powerless to protect themselves and can really only wait for the virus to rip through the prisons.
And this, we're talking from federal prisons to state and even county jails. What type of feedback are you guys getting from some of the people inside these facilities?
Well, we're hearing a tremendous amount of fear and anxiety, quite understandably, not only from the people who are actually detained in these facilities, but from their family members and from staff. We always have to remember prison conditions are working conditions, and the virus doesn't distinguish between prisoners and staff. And so we know that if the prisoners have it today, the staff will have it tomorrow, and the staff's family members and the broader community will have it the day after that. So this is a case where we're all in this together, and we all have to work together to contain the spread of this deadly virus in the prisons.
And so what is the ACLU advice to those institutions and those people who are in charge right now?
Well, our advice is to follow the CDC guidelines and the public health guidelines. I think all of us know pretty much what those are by now. You have to wash your hands as often as possible. You have to maintain extraordinarily good sanitation of the physical environment, because we know that the virus can live for quite a long time on counters and other surfaces. And perhaps most importantly, you have to stay at least 6 feet away from other people at all times. Now, unfortunately, these are things that are basically impossible to do in prisons and jails, and particularly in Alabama prisons, which are the most crowded prisons in the United States. The Alabama state prison system is now at about 170% of its design capacity. Social distancing is impossible. Adequate hygiene is impossible. So what we are saying, and what public health experts are saying, is you have to reduce the population. You have to let people out to reduce the population in the facilities to stop or at least slow the spread of the virus.
Which, of course, to people in the public, certainly in Alabama, that gives them lots of pause on how that works. Can you talk about how the letting people out would work?
Sure. Every prison system holds a large number of people who are low-level nonviolent offenders. It also holds a number of people who are so elderly or disabled that they don't pose any significant threat to public safety. So no one's talking about throwing the gates open and letting everybody out or letting people out indiscriminately. But every prison system has a significant number of people who could be let out without any risk to public safety, and indeed reducing the population density in the prisons by slowing the spread of the virus, in fact, protects public safety. So that's what we need to do right now.
And so two of the inmates that I talked to were very concerned about just access to soap and saying that they have to buy soap from the commissary there at the jail, if the store. Is that proper, and can the public do something to help in those instances by donating soaps?
Incredibly, in many prison systems, it is still the case that prisoners have to buy soap and toilet paper and other basic hygiene items. That's a bad idea at the best of times. It's especially a bad idea right now. Similarly, it's also the case that prisoners often have to pay for medical care. And $4 copay might not seem like a lot to you or me, but for people who earn 10 cents an hour, that's a full week's pay. And so we're afraid that by charging prisoners for medical care, we discourage people who have symptoms that might be symptoms of COVID-19. We discourage them from seeking medical care, and that's obviously bad for them and bad for the people around them. So yes, people can donate but people can also make their voices heard in the halls of government. Prison systems are parts of government. They're subject to democratic control. They work for us. And so if you think it's a bad idea that prisoners have to pay for soap and have to pay for medical care, you can make your voice heard through the democratic process and tell your elected officials that saving lives, both in the prisons and in the community, should come first right now.
And it's the lives of the inmates and also those people who work inside those facilities. Is there anything you'd like to add, David?
Again, I think something like this really brings home the fact that we are all in this together, that the virus doesn't care if you're a prisoner or a staff member. The virus doesn't stop at the prison gates. We know from the unanimous public health expert advice that we're getting that prisons are an ideal environment for the spread of this virus. So it's important to protect everybody, prisoners and staff, and everybody else in this society, that we do everything we can to slow the spread of this outbreak in the prisons. And that requires a lot of different steps. The most important, the most essential step is to reduce the population density to slow the spread of the virus.
David Fathi, the National Director of the ACLU National Prison Project, thank you for joining us.
Thank you for having me.